Hey, good evening. It's Dr. Adam Nally coming to you live on Facebook. It's my nightly check-in with you. And this evening, I thought I would talk about how to not go viral at the grocery store. Everybody talks about going viral. You don't want to do that at the grocery store while you're out and about during this coronavirus pandemic. So how do you not go viral at the grocery store, and what can you do to help protect yourself and keep yourself safe? Excuse me. And it always kicks in with the allergies right before I start talking. It's always exciting. No, I don't have the coronavirus. This is an allergy issue that flares up with me. So excuse me as I clear my voice. Anyway, this has been a big topic in my office today, as we saw many patients coming in with great worries and significant concerns. And so I thought tonight I would talk about some simple things you can do while you're out shopping, out and about, to protect you and your family and not go viral. So hopefully this will help. Number one of the things that I thought was actually really important to understand and to think about, and I'm going to actually add this as an item right here, is as I write this in here, something called, we use the term social distancing. And actually, Dr. Glover is a psychiatrist that I follow, and I've read some of his work. And he actually talked about using the term physical distancing rather than social distancing. And I think that we've just taken this term social distancing, and it creates this connotation of we can't have any interaction with anyone else. You and I are being social right now. This is actually socializing in one capacity. And so we are not truly social distancing. We're physical distancing. Physical distancing is really what we're doing. We don't want to social distance. I think one of the challenges that can arise is, and I'm seeing it in my office, is that when people think they cannot interact with other people because of the terminology that we use, it actually creates some anxiety and creates some depression. So we're not social distancing, we're physical distancing. And we're creating a space of about 8 to 10 feet from other people. We're using masks. My wife made some masks. If you have not checked out my masks, go to darkmuscles.com. There's a link there on that page, and you can use the homemade 3-layer mask. This is my Star Wars mask. So hopefully you like that. Check out the page there. There's a free pattern link to one of the ladies that does some seamstress work. My wife is an amazing seamstress, so check that out. That's on darkmuscles.com. And we want to talk a little bit about how to not go viral on social or on while you're at the grocery store. Let me go back to that screen so we can bring that up. Anyway, number one, we want a physical distance. 8 to 10 feet. So as you're getting ready to leave and go out, I know this can be stressful for some people. So when I was first in medical school and learning to become a doctor in my internship, one of the first things that we were taught is you go into an emergent situation, someone's coding or dying. First thing you need to do is check your own pulse. One of the things I do is I always remember, check your pulse first. You need to make sure you have a pulse before you can help anybody else. So if you're out at the grocery store, check your own pulse first. What that means is take a second, think about what you're doing, don't rush, and think about what steps need to be taken place to get what you need. What steps can you do to protect yourself and to not go viral? Number one, you want to use sterilizing wipes. My wife carries wipes in her truck. I carry them in my truck. I have them in my office. They're everywhere we go. We just made some wipes. The CDC actually has a really cool. Well, the recommendation is we actually ran out of wipes in my office, so we actually had to create our own by using a third of a cup of Clorox and a gallon of water, and we mix that up and we create our own sterilizing wipes. And Clorox is fantastic, kills everything, and so we can use that. That's identical to what they use in the Clorox wipes that you buy and spend a fortune for and can't find anywhere right now. So we made our own sterilizing wipes. If you don't have them, you can make your own. There's about 12 different videos out there. I won't post any right now, but if you have your favorite, you're welcome to post it in the chat bar, and other people can link to it. Just how do you make a Clorox sterilizing wipes? Fairly simple, with a half roll of paper towels and Clorox and some water. Very simple. You just need to make sure the mixture is correct. And that works really well. So have some wipes with you. When you enter into the store, if there's a door, you may want to wipe the handle down or wipe your hands off after you touch the door. If you go to get your cart, a lot of grocery stores where I'm at offer a sterilizing wipe you can just wipe off the cart handle with. And remember, anything that you touch or that is frequently touched, you just want to cleanse. Very simple. Remember, Clorox or 70% alcohol kills the virus within 5 seconds. So you don't have to worry. And if you checked your pulse first, and you remember you're not going to hurt yourself just by walking in the door. And I'm telling my family and my patients to start wearing a mask If you want to read the information about mask wearing, I wrote a whole blog post about it. I've done a video. We did a video last night about it. So, and you can hear my dogs in the background because there's probably a cat walking by. So it is always a zoo at my house. So I apologize about the background noise. Hopefully your dogs aren't running up right now, barking at the speakers, which they might be. And if they are, exciting. Anyway, wipe things down. Use sterilizing wipes when you enter the store. If there's handles, if there's things you're touching, if there's doors you have to open, wipe your hands, wash your hands after that with a sterilizing wipe if you can, and then go about getting the things you need to. Don't touch your face. The average person touches their face 3 to 5 times every minute. So be aware that we have this habit of touching our face. The reason that gloves are worthless, if you wear them as you walk into the store, I had a patient walk into my office this morning and he had to have gloves on. And the problem is he touches everything and then you touch your face, or you touch this and you touch that. The whole point of gloves is not to transfer things to your hand and then to other items. But if you touch one issue with a glove on and then you touch the next, you've just now transferred infection, if it was there, from one item to another or to your face. So the wearing of gloves is not really helpful in this particular issue. The big key is just don't touch your face and wipe your hands down. Third, when you get home, as you walk in the door, wash your hands off, and then you can unpackage your groceries. If you have boxes or non-edible packaging, you can use a sterilizing wipe to wipe those down. I don't recommend moving everything from packaging to new packaging. That actually isn't helpful, and it probably isn't going to do you any good. But if you have fruits or vegetables, just wash them off. Use friction to wash them with instead of soap, but you can use water, and that works very nicely. Once you've washed your vegetables down, once you've kind of wiped off your packaging, you really don't have to worry because you've essentially sterilized and cleans everything off. But again, remember, washing your hands with soap and water kills the virus and it gets rid of it, so it's not a big deal. And then lastly, take a deep breath and check your pulse again because you survived. It's important. Now, if you're using face masks, remember that when you come in, take the mask off and wash your hands, because if you breathe something in, so let's say you put the mask on and then you go take the mask off, if there's something on that mask, you've now touched it. So put the mask down, throw it in the wash, and then wash your hands off. That way you're not transferring that virus that may have been on the front of your mask to your face. And hopefully those are some very simple things that you can do to make sure that you're doing all right. So washing the hands, washing your mask, so you're not transmitting virus from the front of the mask to other things. Again, that's really important to understand. Simple things to do. That's really it. You shouldn't have to go viral at the grocery store. Excuse me. I would limit going to multiple stores if you can. And if there's someone in your home that is immunocompromised, I'd recommend they don't go with you. Let them stay home. Keep them home. Don't make them feel obligated. If you have a neighbor that's sick or ill, or if there's others around you, check and see if there's things they need, so they don't have to step out of the home if they're immunocompromised as often and put themselves at risk. Because the last thing we want to do in this day and age is go viral. Hopefully that is helpful. So that's really the simple nuts and bolts for 8 minutes on how do you protect yourself as you leave your home during this exciting time. Let me just see who's here and answer some questions. And let me close that part of it out here. Let's see. Hello, Paola. It's good to see you. Hello, Allison from Okinawa. That is awesome. How is Japan? How is Okinawa? Genki desu ka? Hello, Mark in Wyoming. Hello, Patty. Vicky is watching from California. That's awesome. Hello, Vicky in Ohio. Yes, I'm doing well, Vicky. Thank you for asking. Let's see. We've got Michelle. Let's see. There's Tawana from Greensboro, North Carolina. Wow, you're up late. Michelle is here. Finally going shopping tomorrow. Ugh. So just, Michelle, take a deep breath. Don't worry about it. You'll do good. I use gloves daily. Well, Paulo, remember how you're using the gloves. Remember, if you touch one thing and you touch another thing, you're transmitting things between that, and that glove is infected. So then if you go to take the gloves off, you've now moved that infection. So knowing how to put on and take off gloves is essential. If you know how to use them, great, not a problem. But remember, a lot of people that I've seen wearing gloves have no idea how to wear them. So if you understand how to wear a glove, great. But if not, don't worry about them. There's no need to spend the money on them. Hello from New York, Dan. It's good to see you. Linda says, I am generally a pretty calm person, but this is causing you anxiety. So remember, Linda, and I've had to reassure patients and my family, 80% of us are going to be just fine. It's not going to be a problem. It really won't be a big deal. It's the 20% of people potentially that will have more severe illness. And those are going to be those that are sicker and aren't taking care of themselves. If you're watching me, I'm sure you're not eating carbs. You've avoided the garbage. Your insulin resistance is healing, and you're going to be doing great. So no need to worry. Just don't go viral. That's the only issue I would say tonight. Hello, Michelle. How are you? Oh, same here. She said. All right. A lot of stress out there. I can tell. Hello, Vic. Hello, Belinda. Sounds like your house. Yes, with all the barking dogs and animals. I had the same thought to make my own wipes. We ran out literally today. My staff was freaking out. I shouldn't say freaking out. They were nervous because we were literally down to the last few wipes to clean the rooms between patients, and so we actually pulled up some information on making our own. My amazing wife rescued us by bringing in Clorox and bags and boxes of wipes that we could seal and make, and so it worked out quite nicely. So even in our medical offices, we have ordered supplies a month and a half ago, and they're all on back order. So we literally I can't get stuff. It's hard, so we had to make our own, which is working, and so we've got supplies, which is good now. Thank you for these live streams. Well, Kimberly, I'm sad the free press that's out there is not giving us very good press. That's the problem. Is where it really is biased. It really is one-sided, and they're missing a lot of important information that could really help you and I feel better about what's going on and not be nervous. I think the important thing is when you start feeling stressed, check your pulse. I think the one, I don't know if it reassured you, but for me, the one thing that I always remember when I worry how bad can it get is just remember that all bleeding stops eventually, and that'll calm you down. The worst thing that could happen is you can start bleeding, but all bleeding stops eventually. And if you think about that in a number of ways, it should calm you. If it makes you worse, then take a big deep breath and check your pulse again. Hopefully that helps. Happy April 1st to you, Kathy. Let's see here. Rochelle says, I put the grocery sacks on the floor when I get home, not the counter. Well, yeah, exactly. So if you put the sacks on the counter, then you're going to need to wipe down your counter after you're done. But if you put them on the floor, that's a good idea. Then clean them as you put them onto the counter. Then you've got clean stuff going on the counter, and your floor can be cleaned after that. Good idea. Fantastic. I didn't even think of that. Very nice. Hello, Tim. How are you, sir? Teaching 155 students virtually. Oh, yes, it is kind of cool. Well, you know what? I think it's a community, not really students. Although the conversation is often one-sided. But I appreciate you guys being here and listening, and I appreciate the interaction because it helps me know what the pulse is out there. I check my pulse, and then I reach out and check yours. So I appreciate that. Hello, Tony from Florence. Hello, Isabel from Florida. It's good to see you guys. I need a mask for extra protection at work. They issue a skimpy one for the day. So you know what, Julia? I have found, and there's actually a study that shows that if you put on a 3-layer mask, this is a cotton. It's what do they call it? It's the cotton material that you use for quilting cotton, with a layer of interfacing in between, and then another layer of cotton on the inside. It's a 3-layer mask. It's washable. It's nice. So you don this on, and then you can put your medical mask over the top of it. And as long as you're getting a good seal over the nose and mouth, you're actually pretty safe. And so that works nicely. So I've read a couple studies that's actually effective. So you might consider that. Hello, Kelly from Waddell. It's good to see you. Hello from Texas. And Becky is in Wyoming, and now hearing headaches and itchy eyes may be symptoms. You know what? Somebody published this. Those are much more rare issues. They're tertiary and they're 4th and 5th things down the line. Really, any disease can cause a headache and itchy eyes, but allergies are the most common cause things that are going to do that right now. If it's just, I had a staff member come in today and say, "Oh my gosh, if you have itchy eyes and headache, does that mean you have it?" No, it does not. Somebody is using shock reporting to try to sell a story, and so don't check your pulse. Check your pulse is the key with that one. All right. Virus isn't spreading much in Okinawa, or they're not testing enough. Well, remember, and actually, if you go to my the most recent, on the article I posted today on my blog about what should you wear a mask, there's a great chart there that was posted on Twitter, and I pulled it over, copied it on the blog from the person who posted on Twitter. And I forget who it was. I've got their name down there. I can't remember who it was. But when I spent 2 years in Japan, and the Asian countries are actually really good about wearing masks. one of the amazing things is, and I actually lived for 2 years in Okinawa. Anytime they get sick, they put a mask on. And that's just part of the culture. And so I really, truly think that one of the reasons that you don't see the disease moving as quickly through Okinawa and the Asian countries is because they actually do a nice job about cultural illness suppression. So they do quite well that way. All right. I love watching the video. Oh, thank you, Twaja. I appreciate that. Hello, Dinah. Is it Dinah? Dinah or Dina for Texas? Hello from Colorado. This is Kimberly. It's good to see you guys. I have people from New Orleans, Brenda and Jean, and let's see, Jake is here. So let me see if there's any questions here. What about the MIT guy who says droplets can be airborne for up? And I missed the last part of that, Vicky. So remember, it's a droplet. If you cough, that droplet unless the droplet somehow defies gravity, gravity's going to pull it down. And if you cough, you're going to probably create an airborne arc for about 10 feet, roughly. Now, can someone cough farther than that? Oh, I'm sure they can. But it's usually most people, when they cough, their head is going to drop and it's going to go about 10 feet. I don't care about the guy from MIT. He can say all he wants to. Again, the only way you're truly going to be safe from anything is if you're donning personal protective equipment with double layered masks, seals, and everything. But most of us aren't going to need that. But what we will need is just a mask that's going to keep that droplet from hitting you or you inhaling it as it comes by you, because you've got a mask that covers your face. And it's not, and when you breathe in, you're not going to be sucking. It's hard for a droplet to come around and up and back up into your mouth. It could, but it's harder. And so your risk, one of these masks, again, studies show that it decreases viral and bacterial infections up to from 10 to 40%. So let the MIT guy talk about all he wants to. He just probably wants to sell something off his blog. All right, up to 25 feet. Of course, he could cough and it could go 25 feet. I'm not worried about that though. If we spend all of our time worrying about how many feet to distance ourselves from, we will never live our lives. That's an important thing. When you start worrying about how many feet to separate yourself from, because some guy at MIT said that, it's time to start remembering, all bleeding stops eventually. All right, could use some Lamberts right now. I don't know what Lamberts is. I'm not sure what that is, Kathy. Let's see. Hello, Jeannie from Idaho. I hope you weren't in the earthquake there, Jeannie. I'm a nurse and we don't have proper supplies. Brenda, unfortunately, a lot of us don't have proper supplies because the supply chain is down. Well, I shouldn't say the chain is down. The chain is improving, but it's the supplies that just haven't been there or for whatever reason have been stockpiled in other places. There was a doc on the Ingram angle talking about the patients that were seriously ill with COVID-19. We all either morbidly, yes, every one of the patients that is seriously ill has insulin resistance metabolic syndrome, which is the cause of prediabetes or diabetes. Jay, hello, Jay from Omaha. You guys are awesome. Yes, Jay, check your pulse. That is, when I get stressed, the first thing I do is take a big deep breath and check my pulse. And if the stress doesn't go away, I just think to myself, all bleeding stops eventually. And then I can handle it. And it makes it pretty easy. I am very careful with gloves and change them constantly, work a part-time job buying and delivering groceries. So I'm going from store to store. Oh, okay. Well, as long as you're changing it and as long as you have a supply to do that, great. A lot of us are running out of our gloves. So we have to be cautious even in the offices with how many gloves we have, because gloves are on back order too. Those are the challenge as well. Let's see. Kathy says they are closed, only have orders to go yet. Okay, I see. Hello, Tony in Goodyear. You're around the corner from me. I always try to center myself when you get overwhelmed. Very, very good idea, Kimberly. Awesome. Bleach and water solution is only viable for 24 hours, then dump it out and make a new solution. No, that's actually not true. If it's sealable, then you're fine. Now, remember, bleach is, when mixed with water, it's the chlorine that actually plays the role in the sterilization process. If that is left as in an open container, that chlorine can weep off into the air and it does lose some of its effectiveness. But if it's a sealed container, you're fine. Nothing to worry about. As long as it's sealed, that's the key. It has to be. So like if you're making wipes, you have a sealable container, you put the wipe in there and you pour the solution in, seal it, and then you open it up when you pull it out, seal it again, no problem. Can you tell I talk with my hands? All right, if my rheumatologist prescribed Plaquenil for Sjogren's, but haven't started because of the side effects, should I start it now? So Mandy, If you need the medicine for a disease process, that taking it is between you and your doctor. Is taking Plaquenil a good preventative medicine? As far as we know, no. And in my perspective, would I take Plaquenil to prevent myself from having this infection? No, because the side effects potentially are greater than the risk of the infection. Now, if you have rheumatoid arthritis that's flared up significantly, I would weigh the pros and cons of treating those with Plaquenil at this point in time. But Plaquenil has some side effects. And so would I recommend using it prophylactically? Absolutely not. I would not. But if there's a disease process you're treating, I would absolutely consider using it because the benefit may outweigh those risks. And so that's the important thing to understand. Do I recommend covering doctors in the hospital prophylactically with Plaquenil? Absolutely not. But if they show signs, then I would put them on it immediately. That's the, if they're positive for the test and they show signs and symptoms of progressing, then that's where we start to consider. I don't think at this point in time with the data that we have, prophylactic coverage with Plaquenil or chloroquine is appropriate. Now, we know that you can do that with malaria drugs in treating malaria, but when you enter a malaria area, we know that having that medicine loaded in your system from the perspective of treatment of malaria does help. But does it help in loading it at a time for this virus? We don't know that answer yet. And unless I see data that shows me otherwise, the side effect of Plaquenil scares me a bit more than just this is not ibuprofen. That's what I would say. I look forward to this every night to have interaction with another human. Well, Linda, I am so glad. We are socially interacting. We are not so we want to physically distance, not socially distance. So we want a little physical distance, but we want to socially interact. So awesome, very very good. Yes, the masks. My mama sending me some from work. Oh, cool, Kimberly. I start back Monday, and I don't know the situation at the hospital. Well, at least you'll have a mask. That's key. Can we shower yet, or is it still wash your hands? Tim, I saw that as well. For you, I would just keep washing your hands, and we'll tell you when you can shower. I watched Jimmy Moore talking about the Merrick protocol for treatment of COVID on respirators. The protocol is intravenous vitamin C, malaria drug, Z-Pak, steroid, melatonin, zinc supplements. Berkowitz in New York is using this. That is the protocol right now that works. It is the vitamin C, it is the zinc, it is the melatonin. Now, I personally am using melatonin and zinc every day. I take melatonin at night and I take zinc regularly because zinc is one of the electrolytes that gets depleted in a ketogenic lifestyle. So I'm using zinc every day. I take melatonin at night. I did not until I read the data on melatonin. So I recommend using melatonin nightly to help as a preventative medicine. I use vitamin C with my vitamin. My vitamin contains zinc and vitamin C already, so I don't think any more needs to be taken. Otherwise, you just create really expensive urine. But the malaria, the Z-Pak, and the steroid are reserved for those that truly have a positive test and are symptomatic. So that is the only treatment that I've seen that has some really exciting data to it. There are some other antivirals that they've used in combination, and I've not seen the outcomes. They've been even smaller groups of people that were treated with those. One of those may be just as effective or more effective. I don't know yet, but that combination is a very powerful combination, and it's actually it was actually used in China. It was used in South Korea, and Dr. Berkowitz has been using it in New York with great success. What would I like to hear from the media? What I'd like to hear from the media is some positives. Go to Worldometer, World Chronometer, I think it's World Chronometer. It shows the infections, the deaths, and the recoveries, and so it's actually a positive thing. That's what I look at every day. I don't care about the deaths. I want to know the whole process, if that makes sense. I'm out making masks to mail out. Good for you, Allison. You're awesome. Thank you from the bottom of our hearts for taking the time. You are very welcome, Jessica. I hope it helps. I hope the content is valuable to you, and we get to socially interact a little bit. It's great. Just checking in, confident that this sounds good information. Thank you, Belinda. All right. Thank you, Kimberly. What about your eyes, even if you aren't wearing a mask? So could it be transmitted through your eyes? Yes, it can. If I am with a patient that I suspect has COVID-19, I actually put on goggles. I have some goggles that we wear My staff, we were putting on glasses and a mask, face shield if you have it. Out and about, does wearing the goggle, is it necessary? I don't necessarily think it is. I don't know the pros and cons of that. That's where the social distancing comes into play. If you're 10 feet away from somebody, the likelihood someone's going to cough directly in your eye is much lower. And the likelihood that you're going to absorb that and your own immune system will pull it in to cause a problem is lower. Could it happen? Well, anything could happen. I could get hit by a bus when I walk out of my house tomorrow. But the challenge is it worth, putting on a bunch of goggles to go out and about? Most of you are wearing sunglasses, during the daytime. So wear your sunglasses, put your mask on. And while I'm driving, or when I go to the store, that's what I do. I have my glasses on and my sunglasses. Works nice. If you wear glasses, you're going to get some protection with glasses. So those of you that are wearing glasses, so no problem that way. I'm not horribly worried about that. Unless you're coming in contact with somebody, you're a healthcare worker, absolutely the goggles or the glasses go on. When you catch the coronavirus, would you recommend to start fasting? No, not necessarily. Although you probably won't feel like eating, and that's your body's way of trying to protect itself. But I basically I would try to follow what my body is craving. But a lot of people aren't going to feel like eating, and so that's just I would follow what the body is trying to tell you to do. There's been no study to say yay or nay. But if you're doing a ketogenic diet, your body's already mimicking that fast. So I'm not really worried. Virginia is on stay at home until June 10th. I heard that. Teresa, it's interesting. History is repeating itself. We had this happen in 1918 and 1919 and 1920. It's 2020. So history is repeating itself. So I'm a big proponent of looking at history and seeing what happened. And then preparing yourself for the next few years to say, this happens. What's the next step? What occurs next? What happens to the economy? What happens to the people? What do they do? What decisions they make? I'm a big advocate of understanding history for that reason. Los Angeles mayor is telling us to wear masks now when you go to the grocery store. Well, that's the first smart thing I've heard from them. That's awesome. Actually, they've been doing some good things. I've heard that, and I'm excited to hear that the mayor is actually saying that now. He must have watched my video. I bet he did. Any suggestions on type and where to get one? My suggestion is make one. I don't think you can buy these anywhere. They make one. If you don't know a seamstress, find one. Find someone who can make one for you. It's actually fairly simple. I know there were people. My wife was actually she's actually making another round of these for my staff, and she was actually at Joann's, which is the fabric store here in Arizona, wearing their masks. My wife and daughter. And there were tons of people there looking for ideas and what to do. Go to my blog or go to my website, docmuscles.com. Click on there's an image there right there of me wearing a mask. Click on that. That gives you instructions on the video and the link to the instructions on making your own. It's not hard. It really isn't. It's really not that hard. Is drinking hot liquids helpful, as they say? No, Becky. Eat your food. Don't worry about hot or cold. Really, I'm dead serious. Hello from Massachusetts, Eileen. Is everyone insulin resistant? No, everyone's not. But 85% of the people that walk through my doors are. If your waist circumference as a female is greater than 35, you're insulin resistant. I guarantee it. If you're as a male, if it's greater than 40, you're insulin resistant. I guarantee it. If you're a male and you go, well, I don't have a tape measure, I don't know what my waist is, then I tell guys, close your eyes and walk toward the wall. And if the first thing that touches the wall is your belly, you're insulin resistant. Cut out the donuts. Hello from Phoenix. Hello, Terry. How are you? Good to see you again. Do I think the quarantine will actually stop at the end of April? Vicky, I don't know. If you look at the projections for each state, they're slightly different. There's a projection. If you go to docmuscles.com and click on the coronavirus picture and you read down, there was a model that modeled each state and the rate of viral uptake based on the numbers that they had that was made. Some states are going to peak in the next week or two, and some states may not peak until the end of April or first part of May. So it really depends on the state. It depends on what's happening in your state and how your state is handling and your city is handling the number of viral infections that are there. So I don't know. That's a good question. Yeah, make your own, says Trish. All right, Linda, right there with you. Okay. I take lisinopril for blood pressure. Do I think I should ask for a different kind of med? You know, Rhonda, my patients on lisinopril and ACE inhibitors right now, I don't think that we need to be changing everybody up. Is it a risk if suddenly you are positive? I would change you immediately. But until you have an exposure or a problem, I don't think just stopping all of our lisinopril across the board is wise medicine. Because the risk of taking you off of blood pressure medicine and trying to find one that works is probably greater than the risk of your infection, in that 80% of us aren't going to have a major problem with it, especially if everything's under good control. So remember, those people that were most severe were diabetics with probably poor control or poorer control. Their A1Cs, I guarantee, were not around 5.6 or less. I'm pretty sure. I have to look at those numbers, but that's the stuff that I'm hearing. How can antibiotics be effective to fight the coronavirus with the beta virus? So Donnie, and I wrote about this on the blog, the coronavirus page. Azithromycin is an antibiotic, but azithromycin has actually been in 3 different studies shown to have viral suppression effects. It suppresses the replication of the virus. So although an antibiotic, it has suppressive effects on that virus. Now, the other cool thing is, because it's an antibiotic, it's going to have a prophylactic effect on pneumonia if pneumonia is kicking in or trying to kick in. So it's going to treat the pneumonia and then suppress the virus at the same time. Plaquenil is not an antibiotic. Plaquenil is an anti-malarial. But the way that it actually stops malaria from transmitting through the cells, it also has a suppressive effect on the RNA replication of this particular virus. But not all viruses, but they've noticed this particular virus. And when you combine the two together, the suppressive effect on the viral replication is apparently enough that within a week, many people get better. I don't know the statistics on the number that actually do recover with this protocol, and that's what the FDA is trying to look at right now. But that's how these work. Let's see. Easy to make the masks, very much so. I think Doc said headache and itchy eyes could be allergic, not coronavirus. You know, I will tell you, any viral infection can give you itchy eyes and a headache. Are these the first two presenting symptoms of coronavirus? Absolutely not. The first 3 presenting symptoms, 99.5% of them had a fever over 101. So that is going to be the first symptom, and we know that occurs within the first 5 days of a flare. Second is a dry cough. That occurred in 80% of the patients. So you had a fever and a dry cough. Third was significant shortness of breath, to the point where people felt like they had to go to the ER. That occurred in 70 to 75%. So those are the first three presenting symptoms that occur between 70 and 90% of the time. Now, itchy, watery eyes, headache, that could occur 10, 20%, but that's usually not the first presenting symptom. So when you're looking at this, could it be that? Yes, it could. But to be honest with you, when 99.5% of people have a fever over 101, that's the first symptom I'm looking for. If you don't have that symptom, your itchy, watery eyes is probably allergies. I quantify that with a probably, air quotes. Do you have a zinc? I do. I have zinc in my supplement. I actually do. My vitamin I designed it perfectly for myself. It is the vitamin that I looked for years trying to find a supplement and could not find one that was effective in that regard. All right, let's see here. Yes. Second, another human effect on your tox. I'm not sure what. Second, another human. Okay. I kind of understand that, Vicky. Maybe you can clarify that for us. Foods high in zinc. Foods high in zinc are going to be oysters and seafood, and I think eggs have zinc. I have to go back and look at my notes. The highest zinc containing foods, I think nuts do, but you want to be careful with nuts because they're high in carbs too. So be careful with that. All right. If you catch the coronavirus, would you recommend starting fast? I think I answered that question already. I probably wouldn't. How much melatonin? I would probably just stay ketogenic to answer that, Tim. How much melatonin? 5 to 10 milligrams is what I'd recommend taking. Are the natural vitamins from ProTerra helpful, and do they break a fast? I have not looked at ProTerra's supplements in a long time, Michelle, so I couldn't answer that question. What interfacing did my wife use? She used fusible interfacing. Let's see here. Kelsey, kale. Okay, yes, kale has zinc. Thank you, Michelle. Yes, kale does. The leafy greens have zinc too. That should have been, that's number one. I don't know why that didn't come to mind. Somehow I have oysters and zinc stuck in my head because they have selenium too. So, and I like oysters. I just do. I like them on the half shell. Suck them off. It's actually really cool. It makes my wife gag to watch me do it, and it's actually really fun. Don't tell her I said that though. Don't. Seriously, she'll be mad. I'll be sleeping in the doghouse with 6 dogs. I don't believe Waddell has a bus service. No, Tanya, they do not have a bus service. That's why I said the likelihood I get hit by a bus tomorrow morning is very low. Etsy sells hand sewing. Etsy sells masks. Oh, I'm sure Etsy has masks on there. Sure they do. Yellowstone volcanoes next month. Oh, wow. Okay. Let's see. Linda's laughing at my silly humor. For non-sewers, you can Google instructions on how to make a mask out of a bandana and 2 hair ties. That would be a start. But I would recommend at least 3 layers. Do you do something like telemed? I actually do, Julie. So go to my website, docmuscles.com. There's a picture of a doctor reaching out of the screen, and that's the telemed link, and you can learn about telemed there. And here comes my cat. Hello from Shelly and Thor in Glendale. All right, my cat is walking across right below. You can't see her. This is his tail, the cat's tail. All right. Did you say everyone that has died or gotten really sick? I said that. So everyone who's died or sick has had a metabolic syndrome, hypertension, dyslipidemia, abnormal cholesterol, either pre-diabetic or diabetic, and or obesity. They all, every one of them has those components there. You are very welcome, Rhonda. All right, let's see here. Hello, Sharon. You're a doc from Austin. You're a doctor in Austin, are you? Or I'm not sure what that meant. Are you aware that Plaquenil meds are no longer available for lupus patients? No local pharmacies can fill my prescription. Debbie, where are you at? So you can't get Plaquenil because it's not available now. Is that what you're saying? I know that some of those medications are made in China, so part of it may be an issue in getting them from China in regards to a supply availability. I am unaware of Plaquenil being held up and prevented from others getting it, although whenever we see a rush on medications, we may see difficulty getting it from your local pharmacy. So I don't know the answer about that in regards to Plaquenil. I would have to check with the pharmacist. I've not heard from them in the last day or two about that. So that's news to me. Can colloidal silver be effective in fighting this? Not that I'm aware of. I have not seen any data on that, Donnie. That question gets asked to me at least 3 times a day, and I've not seen any data that shows it to be effective. Can you, thank you for the symptom explanation. Oh, good. I'm glad that helps. Let's see. Gwen. Hello, Gwen. I have to go back and catch the beginning. Are you suggesting everyone wear a mask out in public? I am. I'm actually suggesting you wear a mask if you know you're going to be around other people. Now, if you're going for a walk in the woods and there's going to be no one there, do you need a mask? No, I'd put it in my pocket in case you come upon a group of rabid elves. But other than that, I would say, if you're out exercising and you're alone, not a big deal. If you know you're going to be going into a grocery store where there's going to be other people, I would take it. I'd wear it. You are very welcome for the videos, Tanya. When you say trouble breathing, is that the same as being hypoxic? Yes, it is, Ramon. It means you feel short of breath, like you cannot catch your breath. So being low on oxygen is one cause of shortness of breath. Let's see, how many magnesium, zinc, and vitamin C should we have? Somewhere between 5 and 10 milligrams of zinc is the adequate dosage. Vitamin C, I would not do more than 1,500 milligrams because all the data shows it creates really expensive urine. Now, if you like expensive urine, take more. Some of you may want to have golden urine that's worth a lot of money, but I don't. All right, you're very welcome, Austin. I heard people using vacuum HEPA filter bags. I've had a couple of people tell me they're using a vacuum HEPA bag. That would work. There's a nice weave to it. I've heard people using coffee filters because they couldn't find fusible interfacing. That would work too. I'm in Goodyear. Yes, Debbie. All right. Hello from Forest Lake. Ooh, up in the nice part of Arizona. Hello, Patty. How are you? Not a doc, just thanking you. Oh, from Austin. Thank you very much, Sharon. You are very kind. All right. I hope this wakes our country up to the fact that we need to manufacture medicines. I hope it does too. I hope we realize how important it is to have manufacturing done here in the United States and the importance of that. I think people are already recognizing that, seeing that. So, all right. tracheal stenosis here, so being homebound. Well, Sharon, wear your mask, check your pulse, and don't stress. I heard using steroids such as inhalers. I heard using steroids. What did you hear? What did you hear about steroids, Jessica? Clarify that for me if you don't mind. All right, you guys, this is great. It's been 40 minutes of rambling and question answering. We originally started talking about not going viral in the grocery store. So we talked about some steps. Go back and watch those. You are very welcome, Dinah. Am I saying that right, Dinah? Is it Dina or Dinah? All right, and I was going to wait and see if Jessica clarified her question for me. There's a little bit of a delay here. Oh, I heard using steroids such as inhalers is not good. Jessica, if you need your inhaler, you need to use it. I think it's horrible advice for someone to say, because there's a steroid, it's bad to use when it's actually keeping you under good control. That's horrible advice. And if someone says that, they need to be slapped upside the head and arrested for practicing medicine without a license. If you have asthma and you need your inhaler, use your dang inhaler. Don't stop using it. That's keeping you safe and healthy and well and improving your stress responses. So I think that's really important. All right. You are very welcome, you guys. Have a good evening. I am going to, let's see, one more here. Kathy, are you only doing online appointments right now or office visits too? So what we're doing right now, Kathy, is we are doing, for simple things that are non-emergent, I'm doing telemedicine visits. Insurances are now covering them where they were not covering them a couple of weeks ago. They are now covering them. So about half to a third to half of my visits and most of my PA's visits right now are online. They're telemedicine because they're non-essential. We don't have to be face-to-face, and it keeps people safe. There are some people, though, that need to come in where I actually do need to examine your knee, or I do need to feel your belly because you're having belly pain, or I need to see that spot because I can't see it on the camera very effectively. And no, dropping your drawers and showing me your backside is not effective on the camera. So I may need to actually physically see you for some things. So some of those more urgent things are coming into the office, and we're seeing those in the office. I hope that makes sense. But we are rolling a lot of them to telemedicine that can be effectively and efficiently and safely done via telemedicine. All right, you guys, have a great evening. I apologize for the dogs barking in the background. It literally is the zoo here. I've got dogs barking at cats and cats barking at dogs and goats neighing at other animals. So anyway, you guys have a great evening. I will see you tomorrow. Remember to wear your mask. Wash your hands, use sanitizer, check your pulse, and remember that all bleeding stops eventually. Keep the fat high, keep the carbs low, and pass the bacon. And we'll talk to you guys tomorrow. Take good care, guys. Good night.